My name is Partik Singla. I'm a Mohs surgeon and a dermatologist here at Piedmont Plastic Surgery and Dermatology. As a med student, we rotate through different medical specialties, get an exposure of what we might be interested in. And I got to see that dermatology has the best of all different fields. There's a little bit of surgery, there's a little bit of internal medicine, pediatrics, etc. And so once I kind of knew I could do more of the surgery and hands-on and the minimally invasive with Mohs, that kind of sparked my interest to pursue dermatology. So Mohs surgery is named after Dr. Frederick Mohs, is his last name. The procedure was invented in the 1930s. The reason it's the gold standard is because it evaluates 100% of the surgical margin when we treat skin cancers, so no other treatment modality does that. When a patient comes to us with a lesion on their skin, we evaluate it and determine if a biopsy is necessary. And I sort of use this analogy of a tree with roots. So there's the top part that you can see, and then there's the part underneath the surface with the roots. My job is to go in and take the roots out. So Mohs is a great option for certain high-risk areas of the body. So lips, nose, ears, head and neck in general, hands, feet, groin, the shins. These are areas that are high risk. We don't have a lot of skin to spare, so we want to be able to close it, keep it as small as possible. So to get complete control 100% and make sure that the roots are all gone. Once we know we're clear, we have a circle where I've taken out the skin cancer and then it's stitched back up and repaired on the same day. And that's a 99% cure rate that we can offer our patients. So that's considered the gold standard. So when a patient finishes their Mohs, it depends on the type of repair that is done. So it can be as simple as letting it heal it on its own. Depending on the location, that can take months to heal, especially on the lower legs if we let it's too tight to close by any other type of repair. I manage expectations in that you can't cut the skin and not leave some sort of a mark. No matter how good of a surgeon you are, there will always be some sort of a scar. The goal with doing Mohs surgery is to keep the spot as small as possible so you minimize the size of that scar. The most important thing I tell patients is if you see a spot there that just wasn't there and it's growing and changing in a short period of time, that would be something that you should come in for. So the recommendation is at age 40 to have a skin check once a year. And that's the basic minimum. And then from there, depending on personal risk factors, that can be modified and increased frequency. If you have a spot that you're concerned about, I'd say come in and have someone look at it. I think it's easy to schedule an appointment. It's easy enough for us to take a quick look at it and make sure that it's not something to be concerned about. So of course, sunscreen is the big thing that we all know about. We would recommend an SPF of 30 or above. Of course, the reapplying nature of every 2 hours is something that a lot of patients struggle with in terms of remembering. And so I'm moving forward to sort of advocating for physical protection, which is like sun shirts, sun hats. They already have the sun protection built in, so you don't have to worry about reapplying the sunscreen in those areas. So if you have a spot that you're concerned about, we have 12 locations and growing. You can certainly visit our website at www.ppsd.com and we'll be happy to help you out.
This segment of QC Life was sponsored by Piedmont Plastic Surgery and Dermatology.